Welcome to Catalyst Medhub, where we ignite understanding and make learning easier. In our today's class, we shall be looking at the anatomy of the clavicle. Clavicle is derived from a Latin word meaning small key. It is also called a collarbone, and it is a horizontal bone that is located on the anterior aspect. It supports the arm, or it supports the shoulder, so that the arm can freely swing away from the thorax. So we shall begin with the introduction. Clavicle, it is also called collarbone, and it is the horizontal bone that is located on the anterior aspect. It supports the shoulder so that the arm can freely move away from the thorax. We said it is also called collarbone. It is slightly S-shaped, bone. Next is the peculiarities of the clavicle. Peculiarities. What are the features that are only peculiar to the clavicle? One, it is the only long bone that lies horizontally. First one, it is the only long bone that lies horizontally. Second peculiarity of the clavicle is that it has no medullary cavity. It has no medullary cavity. It has no medullary cavity. Another peculiarity of the clavicle is that it is the only long bone that ossified from membrane. It ossifies from membrane, except its medial end that ossified from the cartilage. It is the only long bone that has membranous ossification. Another peculiarity of the clavicle again is that it is the only long bone that has two primary centers of ossification. Two primary centers of ossification. Center of ossification. 5. It can be occasionally pierced by middle supraclavicular nerve. It can be pierced by middle supraclavicular nerves. Supraclavicular nerve. 6. It is the first bone to ossify and the last bone to fuse. First to ossify and last bone to fuse. The ossification of the clavicle begins at about 5th and 6th week of intrauterine life. 7. It is subcutaneous throughout. It is subcutaneous throughout its extent. These are the features that are peculiar to the clavicle. Next is side determination. Side determination, the features that will allow you to know that this clavicle is right clavicle or the left clavicle includes: 1. Its lateral end is flat. 2. Its medial end is large and quadrilateral. 3. Its inferior surface is grooved longitudinally. Inferior surface is grooved longitudinally. Its inferior surface is grooved longitudinally. Another side determination of it again is that its shaft is slightly curved. Shaft slightly curved, so that middle to third is convex and its lateral one third is concave. So this is the side determination of the clavicle. Next thing is the parts of the clavicle. Parts of clavicle. Clavicle has 3 parts. 1, it has the shaft. and two ends, the medial end and the lateral end. It has the shaft, the medial end and the lateral end. The shaft of the clavicle is slightly curved and it is divided into two parts, the medial 2/3 and lateral 1/3. The medial end of the clavicle is large and quadrilateral, and it provides an attachment with the clavicular knot of the sternum to form sternoclavicular joints, whereby the lateral end is flat from above downward and it has articulation with the acromion process of the scapula to form acromioclavicular joints. In addition to the sternoclavicular wall joint, the medial end of the clavicle also have articulation inferiorly with the first coastal cartilage. So this is about the part of the clavicle. The next thing is function. The functions of the clavicle include: 1. It helps to support the shoulder so that the arm can be swinged freely away from the thorax. 2. It helps in the transmission of the weight of the upper limb to the sternum. Another function of the clavicle again is that it helps in the attachment of the muscles and the ligaments. So those are the functions of the clavicle. So the next one is the attachments. What are the muscles that attach and what are the ligaments that attach to the clavicle? For the attachment, for better understanding, we will classify it based on the attachment on 1. The shaft, 2. the medial end, 3. and the attachment on the lateral end. For the shaft, we'll be looking at the attachment on the superior aspect and the attachment on the inferior aspect. So we said the shaft. The shaft of the clavicle, it is divided into the two parts. The medial 2/3, which is convex forward, while the lateral 1/3 is concave. The medial 2/3 of the shaft is large and quadrilateral. It has 4 surfaces: the anterior surface, the posterior surface, the superior and the inferior surfaces. The anterior surface is convex and the posterior surface is smooth. So now the inferior surface of this medial wall border has a longitudinal wall groove, and close to the groove there is a nutrient foramen. That is medial 2/3 of the shaft. The lateral 2/3 of the shaft is flat from above downward, and it has 2 surfaces and 2 borders. The surfaces are the superior surface and the inferior surface, whereby the borders are the anterior border and the posterior border. The anterior border is concave forward and the posterior border is convex backward. And the surfaces are the superior surface and the inferior surface. Superior surface is subcutaneous throughout, while the inferior surface presents an elevation for the attachment of coracoclavicular ligament. That is the conoid and the trapezial ridges of coracoclavicular ligament. They are attached to the inferior surface of lateral 1/3 of the clavicle. Now, to the medial end. The medial end of the clavicle is quadrilateral, and it provides an attachment to the joint capsule of sternoclavicular joint, and it also provides an attachment to the ligament called interclavicular ligament, as well as the articular disc. The lateral end of the clavicle is flattened from above downward. It gives an attachment to the joint capsule of acromioclavicular joint. Coming down to this diagram, these are the attachments on the clavicle. This is right clavicle, the superior view of the right clavicle and the inferior view of the right clavicle. So this is the lateral end, and the medial end. Also here, this is the medial end and the lateral end. This is the superior aspect and this is the inferior aspect. The entire extent here is the shaft, And we said the shaft of the clavicle is divided into the two. There is lateral 1/3. So this lateral 1/3 and middle 2/3. Lateral 1/3 and middle 2/3. The lateral end of the clavicle is also called the acromial end. It is also called the acromial end. Acromial end, and the medial end of the clavicle is also called the sternal end. The attachment on the medial end or the sternal end is the capsule of sternoclavicular joint. The capsule of sternoclavicular joint. Sternoclavicular joint. The capsule of sternoclavicular joint. Now, coming to the lateral end gives an attachment to the capsule of acromioclavicular joint. So this is the capsule of acromioclavicular joint. Capsule of acromioclavicular joint. And to the medial end, in addition to the capsule of sternoclavicular joint, it also gives attachment to articular disc posterior superiorly and interclavicular ligament superiorly. Now, attachment on the lateral 1/3. This is lateral 1/3, the superior and the inferior view. The attachment on the lateral 1/3 is the lateral 1/3 of the shaft is that the anterior border of the lateral 1/3 gives origin to the deltoid, and the posterior border gives insertion to the trapezius. So we say that the anterior border gives origin to the deltoid, this deltoid, and it gives insertion to the trapezius. So trapezius, and the inferior surface of the lateral 1/3 gives an insertion to the conoid and the trapezius ridges of coracoclavicular ligament. So this, the trapezius ridges, trapezoid ridges, and the conoid part of the coracoclavicular ligament. Coracoclavicular ligament has two parts, the trapezoid ridges and the conoid part, which together they are attached to the inferior surface of the lateral 1/3 of the shaft of the clavicle. That is the attachment on the lateral 1/3. Coming to the medial 2/3 of the shaft of the clavicle, from the inferior aspect, the attachments are the deltoid and trapezius. To the medial 2/3 of the shaft, most of the anterior surface of the medial 2/3 of the shaft give origin to pectoralis major. Pectoralis major muscle, pectoralis major, and half of the superior surface give origin to clavicular head of sternocleidomastoid muscle. The clavicular head, the clavicular head of sternocleidomastoid muscle. Now, all aspects of the medial 2/3 of the clavicle present a subclavius groove which gives insertion to subclavius muscle. So this is the subclavius, and the outer margin or the margin of the subclavius give an attachment to clavipectoral fascia. Also, the inferior surface of the medial end of the clavicle also gives an insertion to costoclavicular ligament. So this is costoclavicular ligament, and the posterior surface of the medial 1/3 of the clavicle gives origin to the sternoid muscle. So this is the sternoid muscle. This inferior aspect of it, the anterior surface gives origin to pectoralis major. So these are the attachments on the clavicle. Now, in summary, these are the muscles and ligaments that are attached to the clavicle. The muscles that are attached to the clavicle are 1. Pectoralis major, 2. Subclavius, 3. Sternoid muscle, 4. Clavicular end of sternocleidomastoid muscle, the clavicular end of sternocleidomastoid muscle, and lastly the trapezius muscle. So these are the 5 muscles that are attached to the clavicle: the pectoralis major, the subclavius, sternoid muscle, the clavicular end of sternocleidomastoid muscle, and the trapezius. The ligaments that are attached to the clavicle are the costoclavicular ligament, 2. Coracoclavicular ligament, and we should not forget coracoclavicular ligament has 2 ends, the conoid and the trapezoid ridges. And lastly, interclavicular ligament. These are the attachments on the clavicle. The next thing is ossification of the clavicle. The clavicle ossified from the membrane, except the sternal end which ossified from the cartilage. It is ossified majorly by 3 centers. 2 primary center and one secondary center. The 2 primary center on the shaft of the clavicle appears at about 5th and 6th weeks of intrauterine life and fuses at about 45 days. And the secondary center on the medial end appears at about 15 to 17 years and fuses at about 21 to 22 years. Occasionally, there might be a secondary center for the acromial end. So, and the clavicle is the first bone to ossify in the body and the last bone to fuse. And it is ossified from membrane except its medial end. It has 2 primary ossification center for the shaft and 1 secondary center for the medial end, and occasionally 1 secondary center for the acromial end. The next one is the clinical correlation. The clinical correlation of the clavicle includes 1. Fracture of the clavicle. The clavicle is commonly fractured at the junction between the lateral 1/3 and the medial 2/3. That is where the fracture of the clavicle commonly occurs. The junction between the lateral 1/3 and the medial 2/3. Another clinical correlation of the clavicle is clavicular dysostosis. This is the condition in which the lateral 1/3 and the medial 1/3 of the clavicle remain separated. That is, they do not fuse together. If the medial 1/3, if the medial 2/3 and lateral 1/3 of the clavicle remain unfused or they are not connected, it is called clavicular dysostosis. The next one is cleidocranial dysostosis. This is a congenital disorder in which the clavicle is incomplete developed or completely absent. The incomplete development of the clavicle or completely absent is called cleidocranial dysostosis, whereby if the medial and the lateral aspect of the shaft refuse to fuse together, is called clavicular dysostosis. These are the common clinical correlation of the clavicle. We have come to the end of the anatomy of the clavicle. Kindly subscribe, like, comment, and share. Don't forget to turn on your notification bell so that you don't miss any new video.